Hey, this is Dr. Charlie Johnson, back pain specialist, physical therapist, and owner of PT&J. In today's video, I want to share with you how a lot of people with back pain, they make a huge mistake, and that is that they try to do everything versus using focus and doing just the one thing that's going to give them the best results. So yeah, the biggest mistake I would say that most people with back pain make that actually stops them from healing is, first off, they ignore it, right? And they say, hey, this will just go away. They go down this path of just saying, it hurts a little bit, I probably did something a little funky, I probably tweaked it, but it should just go away. Well, it doesn't go away, and then they start to alter the problem. They take injections, medications, things that kind of camouflage or cover it up. And then they say, screw it, I'm going to try everything, right? And that really leads them down sort of a deep, dark rabbit hole, all right? Now, with that being said, most people who have lower back pain, right, they've tried everything. So just get this. This is what most people with back pain, this is what their attempt to treat it looks like. After doing nothing and then altering it, now they're just trying everything. They're Googling it, they're going to yoga, they're doing PT, or they've tried PT. They've been told to maybe give a trial of massage, or their best friend sent them to the chiropractor, or recommended they try that, right? So you've got PT here, you've got yoga, you've got Google, or YouTube, right? You've got chiro, you've got the surgeon, or pills, right? You could go on and on, right? So what we see is that everyone, and you should understand this, everyone you go to see for your lower back pain or leg pain or really any problem in life, they're all wearing their own goggles, right? And what I mean by that is they've all been trained in sort of their own theories and ways to see things, right? So for example, if you go to see the PT, right, and I'm a PT, right? So if you go to see a PT, a lot of times you're told, hey, your one leg is longer than the other, you're weak, right? If you go to see a yoga instructor, they're going to say that you just need to improve your flexibility, or maybe you're stressed out or whatever, right? Generally, you go to Google, you have cancer. If you go to see a chiropractor, traditional chiropractic might say you're out of alignment, yeah, that's the issue, right? If you go to see a surgeon, don't be surprised if you're told you need pills, injections, or surgery. So just know that going into any of these, don't be surprised when you're told that if you go to this person, this is what you're told, this is what you're told, this is what you're told, right? So everyone's going to have their own specific problem that they're going to tell you is wrong with you because they're all wearing their own goggles, right? And understand then that the treatment you get, so if the only tool you have is a hammer, everything's a nail, so the treatment that you get, not only is who you go to see going to determine what you're told is wrong with you, your diagnosis, right? But it's also going to determine what you get. So again, if the only tool you have is a hammer, everything is a nail. If you go to the chiropractor, generally it's going to be some type of hands-on manipulation or adjustments to correct subluxations, right? If you're a PT, generally you still might get some type of hands-on adjustments or manual treatment, right? And strengthening exercises to strengthen your weak core. You're probably going to get stretches here. You're probably going to get pills, injections, or surgery to fix what is wrong with you on your image, all right? So with that being said, just understand that, and then also understand when you do this, right, picture this is an E, right, and this is for energy. So this is the sun, we'll just say that, right? And it's got 5 rays going in 5 different directions. So if you wanted to go anywhere in life and you went to the airport and you said, hey, take me to blank, right, but make sure the plane goes in 5 different directions, right, at one time, well, you'd never get there. The tail would be going this way, the other tail would be going that way, one wing would be going that way, like the plane would fall apart, right? So the issue is that you don't get very far, you never get to your destination, right? You don't get very far in any given direction to truly tell if it's going to help you, because most people, their energy is severely diluted, all right? A lot of people see it as an opportunity to try to see if a lot of things are going to work, but in actuality, it just reduces the effectiveness of all these things. Not to mention, when you go to PT, right, they might give you a whole sheet of exercises. When you go to chiro, they might do a whole bunch of different things. When you go to yoga, you're doing 45 different moves for an hour, right? If you go to surgery or see the surgeon, you're getting 3 different pills, a muscle relaxant, a painkiller, some type of anti-inflammatory, an injection, whatever, right? So the people you even go see further dilute your energy. That doesn't get you anywhere, right? So understand the biggest mistake people make is that they do everything versus what if we could step back, we had somebody who could see the whole picture, right? Understood all these various treatments, and then could give the specific, the best and most specific thing and one or two things for your needs, right? So this is what it would look like. So consider this is a much better approach. So let's just say we've got 1, 2, 3, 4, 5 rays, if you will. They're about 1 inch or 2 inches long, right? So now imagine instead of going 5 different directions, we could just go 5 inches or 5 of these, right, combined in one direction. So that's like a pressure washer. That's like a laser. That's how you cut through diamonds, right? That's how you make diamonds. That's how you focus energy, right? So get that, right? If somebody's going to come see me, the way that we best treat this and manage this energy is that not only do you just see one person, but then you only do the best 1 to 2 things, right, for your given problem, right? So it starts with the question of, hey, what's going on? And then what if we just did, instead of 10 different things, a whole sheet of exercises? What if we just did 1 or 2 things, right, that most specifically address your problem, right? So this way we can really tell what's happening, right? And at the end of the day, we're going to be able to know, hey, am I feeling better? Am I feeling sane? Or am I feeling worse? Right? And then based off that feedback, we can go and we can redirect the energy, tweak things, switch things up, right? And make some moves there to try to refocus such that we can find what makes you better versus, what makes you worse. And, the good thing is that some people say, well, if I do this, right, and I feel better, then that's all I really care about, right? And what I would say, and what I would challenge you to think about is like, well, how do you know then what's making you better? Right? And if you don't know what's making you better, then in the future, if you ever have a back problem again, you don't actually know what was helping you. So therefore, you just have to drop right into this, this washer, this spin cycle of treatments to figure it out again, right? Versus if you do 1 or 2 specific things, right, and you feel worse, you know exactly what makes you feel worse. If you feel better, you know exactly what made you feel better, right? And then from there, you have full control of the problem. So again, don't make the mistake if you have back pain of doing everything. Instead, find someone who can focus, zoom in on, and be laser focused, pressure washer effect, as far as doing the best thing, the one thing, and thinking really critically about what that is and helping you coach through the process of how you can find natural relief from your pain and your problems by doing less versus doing more.